Welcome to Rich Conversations, this podcast where we explore our curiosity and talk to people all over the world in all different fields. Today, we are rejoined by Rafael Añorga. He was on episode 187, where we talked about CRISPR and gene editing and all these biological things. It's so exciting to have you back. Welcome back to the show.
Thank you so much for inviting me. Always a pleasure.
So why don't you briefly introduce yourself again?
Okay, so for everyone here, my name is Rafael. I'm a transfer student from Peru, and I'm currently completing my undergraduate degree at University of Illinois at Urbana-Champaign in biology, and I'm about to start my master's degree next fall semester at the University of Illinois Chicago for biostatistics.
I'm so excited that you're going to be moving here to Chicago, where I am. That's exciting for me because now we can record in person. Then they'll be.
Oh yeah, next time we see each other, it better be in person.
Yeah,
for sure.
So you're going to be here in the city. I'm right now. We're recording this in the evening, and during evening recordings, I like to drink a glass of Bordeaux or two or three, and so we're going to be sipping here. We're going to be talking public health today. Just gonna like pick your brain about it, and so many different topics and things to get into. But to start off, what is on your mind most with public health right now?
So it was like, I don't know, like there's so many topics as you just said, but I mean, we can start here with COVID. We can start with maybe also obesity in the US or some other problems you have seen like over the population.
Let's I'm not known to talk about COVID on this podcast. Why don't we get into COVID? Because where are we statistically? I don't really pay attention to the news. I used to look at the statistics, now I don't. Like, can you share with me where we are with COVID?
Yeah, sure. So like I used to be like pretty much into COVID like from the beginning of the pandemic, but over this like a couple of months I haven't taken too much action about it. However, like I still have a good idea where we at by right now. So like for example, Chicago has already raised all the mask mandates. Like most of the population has like double vaccinated, up to triple vaccinated, and I know some people who actually got the second booster, right?
Mm-hmm.
Right around that track. So right now the variant of prevalence, it's Omicron, of course, but the problem is that Omicron is divided into two different categories. It's like the variant B1A and the variant B2A. I don't know exactly where they originated from, but there are some theories about Omicron, to be honest. But the problem between the main difference between Omicron and the Delta variant is that Omicron is like more transmissible.
Okay, so is that what we're on right now? I thought Omicron was like in the winter.
It was over the winter, yes, but
is it still around? There's not another variant?
No. We're with the B2A right now.
We're in what?
B2A. That's an Omicron subvariant.
Okay.
So that's
explain this to me.
Yeah.
How does a virus become a variant, and then how does it become a variant of that particular variant?
Actually, do you allow me to share my screen? Actually, I have the perfect explanation for this.
Yeah.
Okay, let me get into a map because like there's a page called Next Train. I learned in my class, and it's amazingly good to actually explain that question. Let me open it up.
And you're coming from this, we're talking about public health. You're coming from a biological perspective, a researching perspective, and a statistical perspective, right?
Yes, but I feel that I want to get more into statistics just because like I feel that like by the methods I'll learn in my statistics program, I'll actually be able to explain that phenomenon more accurately.
Yeah.
Okay, so I don't know why my screen is like that, but let me put it on Reddit free here. So have you ever heard about phylogeny trees?
I don't think so.
Like let me show you. So can you see this tree?
Yes. So we are
Okay, let me start basically.
Okay.
Let me see if I can pull it out. Okay, so here's
What
where COVID
program is
started.
this?
Oh, that's only a web page. It's called NextTrain, where they actually get all the COVID variants and they input it here.
Okay.
So we started here in 2020 with the original variant, right?
So this is like the family tree of the COVID.
Exactly.
Okay.
Yes. That's how like the best way we can explain how COVID is like emerging, to be honest, or like creating another variants. So
wow, this visual is much. It's helpful to understand. I can kind of see.
And at
see
some point,
something here.
I didn't know if like vaccines were actually, did any effect on Omicron. But after seeing this, I actually understand now why it's like this going on. So
Okay.
to start with, we start here in 2020, right?
Mm-hmm.
And you can see how this actually like split in two different subgroups. You have the Delta group, you have the Omicron group, you have the Alpha group. And it's actually pretty interesting because you can also see like where in the country, which one is the most prevalent.
Yeah, so we're looking at it right here. It looks like the yellow. So the Omicron is the most prevalent, which you said is the most transmissive.
Mm-hmm. And let me tell you why. So if we go to the unrooted tree, we can actually see like how far from ancestors these variants are. So what happens when the vaccine came over? All the companies, Pfizer, Moderna, and well, the other people who actually developed it, they did it to actually fight the Delta group. But what happened here? We have Omicron, which is like a really far ancestor from Delta. Like they're not even related here, as you can see.
Okay. Yeah, they're far apart. Yeah.
Exactly. So what's the deal with the vaccine here? Like there was a paper published by I don't quite remember if it was like late December or early December of 2021 when Omicron first started. And they actually predicted that Omicron was going to be the new popular variant among us, which actually ended up being the popular variant.
Mm-hmm.
And they should talk about the vaccine efficacy. And with some studies they did, they actually found out that either vaccine you have like Pfizer or Moderna or Sinovac, whatever you have, is not going to help to neutralize the virus as it helps to neutralize Delta, because the vaccine was designed for Delta. It was not designed for Omicron.
So why was it designed for Delta and not Omicron?
Because like the mass vaccination started with Delta. It didn't start with Omicron. When we thought that everything was like perfect, like Omicron showed up and the cases there was like a reboot in cases increased again. And well, I think that virulence hasn't changed much, to be honest. I don't know if there's like enough data to support that actually Omicron is more deadlier than Delta, but it's definitely more transmissible just because it promotes immune escape.
And Delta was the more dangerous one, right?
Yeah, remember Delta was like the big deal around everywhere. And people were dying on this variant. Like not so many people have died on Omicron, but here's the deal. People who already caught Delta before in the past can get Omicron just because of the distance in variants here.
This is where it gets kind of confusing, right?
It's quite confusing, but you can get reinfected if you're wondering.
Okay.
There's like 100% chance you can get reinfected.
So what is so we've had the vaccinations. Are now that like Omicron is more popular, the vaccines work to eliminate the severity of it?
Okay, so here's how it works. So with Delta, the vaccines actually help a lot in neutralizing the virus. The vaccines already have some neutralization activity. But with Omicron, because Omicron has so many mutations in the spike protein, like the monoclonal antibodies from the vaccine cannot actually neutralize this virus. However, as I mentioned a little bit ago, this paper actually, said about Omicron and all of it. And at the same time, they also mentioned that it doesn't matter like how many booster shots you have, you will not get Omicron out of your body. But you will like prevent going to the ER with the vaccines.
Right. So then where do you see it going moving forward?
That's a really hard question, to be honest. Like,
yeah, that's the $1 billion question.
Like all of us thought that the pandemic will have like being over with Delta here with this group, But then this happened, and you know why? Like, the super interesting thing about this is like we don't know where Omicron came from, but one of the theories comes back from the past. Like, remember when you saw in the news that animals were starting to get infected with COVID?
Yeah.
Okay, so the virus jumped to animals, and the virus mutated inside the animals, and they jump back to humans, and that's how they think Omicron started.
Biology. That is biology right there, isn't it?
A lot of virology. Yep.
So then so the Delta variant is still out there, right?
The Delta variant is still out there, but it's not as prevalent as Omicron. Omicron right now is the most dominant one. Like, getting Delta these days, I think, is quite weird compared to getting Omicron. Like, most of the US cases are Omicron.
What was the country, if you scroll down, what was the country that has Delta as the main one? Yeah, in South America there. What is that?
It's into a clade. Is that, I think it's Argentina or Chile, one of the two.
So most countries in the world, it's the
Chile.
Yeah, it's the Omicron variant, but Chile has
Delta, according to this. Yeah, it has more Delta. It has more Delta prevalence. They still I'm pretty sure they still have some Omicron, but yeah, they have Delta. Right now, between Peru and Brazil, it's Omicron. But there was, for example, a point in Peru I remember quite well, because I got COVID by last year, in which we didn't know which one was more prevalent, if it was Omicron or Delta. We didn't have enough technology to actually sequence all the data and actually determine, oh, this is Omicron, or no, this is Delta.
Wait, so go back. That if someone gets it, how do they know which variant it was?
Okay, this is like another process, but it is possible to know which variant you have. So these days, like, in order to study the genome, we have something called Sanger sequencing, in which they basically code the whole DNA or RNA of the organism, and according to the mutations it has, you can actually how can you say this? You can actually compare it to one of the variants and determine if it's the same or it's a different one. That's how they know if it's like Omicron or Delta.
Okay.
It's a lot of numbers.
What's the other countries that have Delta as the majority?
Well, the US.
There one in Europe.
In Europe as well, but in Europe right now they're facing the B2A, which is Omicron, no Delta. Okay. But there's still, like, as you can see, like a good percentage of the cases which are Delta. Same in the US, but most likely to find is Omicron.
So what does it mean when a country has a larger circle compared to a smaller one on this?
I think it's just like up to the population, to be honest. Or like how severe the cases are. I'm not quite sure about that.
So, like, I'm curious how, when we're looking at this.
Oh no, I think what's going on here. Okay, like, taking a look into second look into this. Like, have you seen the countries with the most infected people? I think these circles, like, the bigger it is, the more infected it is. With COVID in those terms.
Like more cases, right?
More cases. There you go.
Yeah. So how does, like, a country like Spain have, like, a much smaller circle than other countries in Europe?
So yeah, that depends. Actually, that's up to the restrictions that governments took place, like, way back in the days, and they're still taking on. For example, I'm not quite sure what they're doing right now in Europe, but for example, I'm pretty sure in the United Kingdom, they're actually taking, like, letters about not letters, like, there's something in Spanish we say, like, cartas en el asunto, which means, like, they're taking action about it.
Okay.
So
what does Africa look like?
Oh, it's Africa. Well, here's also one problem with Africa. Africa does not have, like, a lot of public data.
Okay.
Yes.
So you would say, especially as someone in biostatistics, that data is pretty important.
Incredibly important.
Yeah.
And to be honest, like, with COVID, I hate to say it, but I mean, we have get a lot of data from viruses that we didn't even know before, and COVID, like, itself is a huge opportunity to study the behavior of the viruses.
Okay. So what do you take away from we're looking at a map of the world with cases, and We have the tree. What is your big takeaway from the visual graphs of COVID?
My best guess is that COVID is still gonna keep going. There's like a lot of new variants every single day, as you can see here, and in my opinion, it's just not keep going on. But there's always a possibility that something as Omicron happens that evolves independently from the other variants, which will create another problem. And we hope that doesn't happen.
I like that last statement. We hope that doesn't happen.
Yeah, because like right now with Omicron, I think Pfizer is developing a vaccine just for Omicron specifically, just for neutralizing the virus itself.
Okay, so there's a lot of coverage about people not wanting to take the vaccine. What does the vaccine do to a person inside them? Can you share the knowledge you have about what happens when you get a vaccine, and then if we need a vaccine for another variant, what will that do to one's body? Like what happens there?
Okay, I wish I knew like way more for the COVID vaccines, but I got you. But wait, to be honest, like I mean, how can I start this? Okay, so like most of the population has done a really good job in getting the vaccines, to be honest, and with that they have taken down the possibilities of going to the ER. So the vaccines have saved a lot of lives. However, in terms of the booster, I think the booster was recommended when Delta was a little bit more severe, and I completely get that. Like sometimes you need like a booster just to increase the antibodies in your body, because like this vaccine is pretty new, to be honest. Usually a vaccine takes like 20 years to go into the market. This one took like only 1 year.
Yeah.
So it's like basically trials took place in the start. They have the evidence saying that the vaccine works, but people still don't want to take it. I don't know why, to be honest, but I'm pretty sure, like, my best guess is that it's because of these people who doesn't want to get vaccinated that these new variants are emerging as well.
Yeah, so to a person like that who's using that reasoning, these viruses keep happening. Why should I get a vaccine when it was designed for Delta and not Omicron and how it's going to evolve?
Okay, I have a perfect answer for that. It's like, okay, do you want to go to the ER or not? Like, being serious, you want to go to the ER or not? Like, it's been proven that, for example, like, even though you have Pfizer, Moderna, or whatever vaccine you have, like especially Pfizer and Moderna, they reduce the chances of going to the ER like up to 90%, between 80 and 80%, which is quite a lot. And imagine you get right now, imagine you're like another person, you get COVID, you get Omicron, and you're not vaccinated. Like, what are the chances of going to the ER? They're pretty high, to be honest. And if you get through the ER, then it comes the cost of all of it, which is quite high, well, for my understanding.
Yeah, I think that was something with COVID. I remember when it first was happening, this is like March, April 2020, and getting my years all mixed up already. And that was like the huge concern, is like the ER, we need beds, because we don't want to be in a situation where you're turning people away from the ER. So in that, and that was the big rush of getting the vaccines out, right? Is so that the ERs don't fill up, and then, people don't get treated because they can't get into an ER, right?
Like, if, for example, in Peru, when I went back just to visit my family, like, they put me in isolation for 120 days. It was crazy, to be honest.
Wait, what?
Oh, I never told you about it?
No.
Okay, so
this was after we recorded. We recorded last in December, I want to say.
Last in December, I think, right? So, okay, that same year, like on January, I came back to Peru just to...
Here, we can switch off the screen share.
Oh, yeah, sure. Okay. So going back to Peru, like in 2020, I remember when the COVID first hit here, and I didn't want to leave the US, to be honest. But at the end, I was like, yeah, I'm just gonna go to my family. Like, I don't think it's gonna be a big deal. What happens? I come to Peru with COVID, all everything going on. And then my parents were like, oh, by the way, we're gonna go into lockdown for 2 weeks. I'm like, wait, what? And they're like, yeah, the rumors already started, and you know how is it here. When rumors like go around, it's most probably to happen. So yeah, we went to lockdown for 2 weeks, and after 2 weeks, the president came out saying, "Okay, another 2 weeks, another 2 weeks, another 2 weeks, another 2 weeks." And
This is
at the end,
2020 or 2021?
I think it was 2020,
Okay. So this is
and
before we talked. Yeah.
yeah, way before we talked.
Okay.
And yeah, it was like I mean, it passed like 3 months, to be honest, at the end, and it was isolation, like fully. I wasn't able to leave my house, and I remember also the big lines that people used to do at the markets. I remember that my parents used to go out from home around 8 a.m. just to get the groceries for the week, and they will come back around noon or sometimes even 1 p.m. I was like, why are you guys taking so long? They were like, oh, I recorded the line. It was like all around the block. They only
Yeah.
have a maximum capacity of 25 people.
And this was in what months in 2020?
In the very early months. It was by spring break, if I remember.
Oh, so you were back in. So when COVID was happening or started in 2020, this is like March 2020.
Yeah, it was like really near spring break. I remember pretty well.
Okay, so you went back right away.
Yes, I went back right away.
Okay.
Mm-hmm. And
Yeah,
vaccines were not in the market. There was nothing.
Yeah, that was a wild time, wasn't it?
That was a wild time, yeah. And I really got really scared of COVID. And
yeah,
also like the testings in Peru, then those hurt. I mean, they
didn't
hurt.
The what in Peru?
The testing for COVID.
Oh yeah. How many times have you gotten tested total?
I mean, Peru or like all across the pandemic?
All across.
Wow. I don't have a specific number because like last semester we were required to test like twice or 3 times a week by the university here.
Oh, you had a test like 2 or 3 times a week?
Yeah, that was perfect because like,
oh wow,
you can get COVID cases just like this, and then you can put them in isolation and actually, lower the incidence.
Wow.
But here the tests were not like the nasal swabs; they actually were like spitting tests.
Okay.
And those work perfectly fine, but in Peru, like I remember the nasal swabs.
Those
like,
first ones?
Oh my god, all the way down to the brain, like you could see the light there.
Yeah.
And sometimes I feel that the missed cases here in the US, like the cases like people don't know they have COVID, are because of that. Because now, for example, if you go to a CVS and you want a nasal swab, you just do like basically this in the superficial of your nose, right?
Yeah.
But I don't know if that's enough to actually get all the material you need to do the PCR. Like, as I mentioned, in Peru, they'll put it like all the way down to the back of your throat.
Yeah.
And that's maybe like also one thing that might contribute to the cases in the US.
Huh. Okay, so you were improved, but that was before we talked.
That was way before we talked.
Okay, yeah.
Okay. And yeah, after that, I remember like when I came back to the US, the airport was closed, like to start with. And I came back in a communal flight in which like only students and American residents were able to jump in.
Oh wow.
Yep.
This is from Lima?
Oh yeah. It took me almost 24 hours to get to Miami.
Whoa.
Yep.
So that's where public health intertwines with certainly people's lives and memories, and everybody will have memories of this time and stories like you just said of like what you did specifically. And you're talking about in Peru and the lines for groceries, and they didn't come back for 3 or 4 hours. And I have my own of like, groceries, and it's staying inside for like not leaving the house for like 2 weeks. And so we're like seeing for the first time in most of our lives across generations this kind of impact that public health has, and virus in particular with public health, how do you see the next 2 to 3 years going as far as COVID generally in your opinion?
So in my opinion, it's like, as I said, that we don't know how COVID is gonna keep evolving, but hopefully it evolves for the best, like to become less transmissible in those cases. And I hope so as well that Pfizer already releases a vaccine for Omicron or which other subvariants they have, and that most of the population gets vaccinated. Like if all of that happens and people still wearing their mask in like really close spaces, like yes, we can come like to a, I mean, we can actually go down for the curve, like, you know, in order to actually lower the COVID cases. But in terms of public health, like it's quite unpredictable at this point. It's like, I always feel that if we did what the CC told us to do, like from the very beginning, like we'll be in another situation right now. But I got no idea why this topic became so political.
Well, I think we have an idea of why and why, and like the internet and egos and ideologies and yeah, I'm sure that has a lot to do with a lot of things, but
yeah, but I feel that politically, like that like actually influenced how people acted towards COVID, because like in past pandemics, I think this was on 2010, I think the H1N1, remember? Like people were wearing their masks, they were pretty chill about it. Like I don't remember it being such a big deal in the news. Like I was 10 years old, but I still watch it. But with COVID, people got crazy about it.
Yeah, it was like, yeah, it was, well, what I think it's like the far ends of both spectrums, and it was like they were just like combating each other, but that's all you would see, because like with media and the internet, it like magnifies extremism or sensationalism. So then you think, you're not thinking of like a majority of reasonable people. It's like it what do you call it, highlights the extremes part, and then you think that a majority, or it's like statistically, right, you're looking at statistics, it's not representative of an entire population's thoughts and feelings. It's the loudest part of the population whose voices get magnified, it seems like.
Exactly. Yep. But at this point, I always feel like, I mean, political stances does not matter when it comes to the health of the whole community here. Like if we want this to be over, stick to the F rules, you know? It wasn't that hard. Just get your vaccination, get your mask, try to isolate for a little bit, and we'll be fine. But people just took all the contrary about it.
Yeah, it's interesting. So, but do you feel like we're kind of through the hardest part of this?
I don't know, something in my mind clicks saying that, I mean, Delta was the toughest one and we already went through it, but COVID is still here. Like, I don't feel we should lower the guard right now. It's like we should actually keep it going as we were going, so actually the cases can go down.
How do you think how has our approach, we're seeing the something as big as COVID, right? This happens within our communities and society, and it creates a focus on public health in a way that, and a conversation about public health that hasn't been there in the past. How do you see, and I think you kind of led into this a little bit earlier, but how will this now affect how we talk about public health moving forward?
Like, I think like, I mean, public health before the pandemic to start with, it was not such a popular deal, right?
Yeah.
Like people will usually go in there if they actually want to help their community or want to like study epidemiology or summer diseases. But after the pandemic, I feel that the topic of public health is just gonna explode, you know, because
Yeah.
like after what happened, I feel that most of the people I mean, they are willing to go to public health just to try to avoid what happened here.
Yeah. And you can see how public health can, there's so many effects of it where we talk a lot about like the supply chain being all wonky now too, and still not corrected. And that affects the economics of everything, and everything's kind of interrelated. It's interesting. And it's not over yet either.
It's not over. It's not over. Definitely not. But I mean, as I said, people are starting to take it a little bit more lightly, you know?
Yeah.
Even me, to be honest. Like sometimes I feel like I don't want to wear my mask. I don't wear it. Like I just wear it when I'm in class, to be honest. Or if in like a really confined space, I'll actually put it on. But otherwise, it's like,
yeah, we have the only place in Chicago that people wear masks or it's mandated is the CTA. And CTA. I would say probably about 75% of people abide by the rules. And it's not enforced. And I think that's another thing too, is like the enforcement has been like, it's like there's a mandate, but then also it's like almost impossible to enforce. And then like at what level are you enforcing it, right? Like I was working at a restaurant this whole time, and we enforce it as much as we can, but also like there's only so much you can do in a way, right? But yeah, I think people it's a pretty good number. I would say like 75%. If people just take an extra precaution on the train, it's not too big of a deal. I don't think people are too concerned about that. It's an interesting time.
Yeah, but as I said, like hopefully people take more awareness after this pandemic, and for the next pandemic, like I hope people actually like take a look back into COVID and be like, okay, we actually screw up here. Like we need to actually make things right this time.
Something like this is so immediate, where I'm looking at top public health problems on Google right now. Biggest public health concerns.
Is it bacteria in there?
Is what?
Is bacteria in there?
It is not.
No?
It is. Well, maybe it's okay. So this is what the list has. Heart disease is number 1. Diabetes, stroke, obesity, cancer, mental health, hypertension, injury, tuberculosis, violence, climate change, influenza, depression, substance abuse, air pollution, type 2 diabetes, coronavirus disease 2019, global health, Alzheimer's disease, chronic diseases, environmental health, hospital-acquired infection, breast cancer.
I actually am surprised that they have like cardiovascular problems and diabetes before COVID, but
I guess they're talking about, those are the effects, right? Not the cause.
Yeah, but in terms of you're right. They're talking about the effects like cardiovascular disease. There's a lot of things that can trigger it, diabetes as well. And that has to do with, like, believe it or not, with food consumption, like a lot of it.
Yeah. So your focus is on statistics, research. Like a lot of these public health issues are coming down to like diet or
I hate to say it, but yes.
What'd you say?
I hate to say it, but yes, like most of those problems like comes to diet, cardiovascular diseases, diabetes, obesity, all of that comes to diet. a big part of it.
So why aren't we talking more about that?
It's because like how can I say, like US
Like, isn't
people
this
love,
obvious? If you look at
it's
this,
obvious, yeah, it
this
is.
list,
Yeah, it's obvious, but still people love to consume sugar here. Like, have you realized? The American people love to consume sugar, and I get it, it's delicious, but it's killing us.
so how do you go about talking about that in like a non confrontational way or agitated way? What do I want to say? Antagonistic way.
Okay, yeah, I know what you're saying.
Like, how do you explain to people that the food we're eating is it's more likely to cause harm to you in the long run, and then as a society, as a country, it's gonna be harmful to us long term as well?
That's a good thing. It's really hard to convince people like what they should eat and what they should not eat. But like one way to actually convince them, I'll say, is like, that's a really tough question, to be honest. Like
that's probably why this is an issue right now. Because it is
maybe,
so hard,
yeah.
right? Otherwise, it wouldn't
be
be an issue.
Yeah, how do you explain to people without getting them triggered?
Yeah, that's a good word. Yeah.
Yeah, but it's like, okay, for example, dang, this is pretty hard. But maybe a way to actually picture it will be maybe to look at the past, like by the 1820s, maybe the 1900s, before actually processed food became a huge deal here in the US, right? Like sugar consumption back in the 1800s was extremely low, like I think 5 pounds a year or maybe less. I think today it's almost 30 pounds a year of sugar consumption.
Yeah.
And that's actually has to do, like, for example, the Coca-Cola, all those sodas, even yogurt, even fruit, believe it or not, like orange juice, that can be like pretty bad for you.
Yeah. So what are you supposed to look at on the label then to indicate?
I wish I have some label here, but so usually when I do groceries, like I'm mostly concerned to what I put into my body, to be honest, because I don't like to put like too much sugar or too much refined carbohydrates or refined food.
Let me see what I have around.
Like anything, even that candy, I will say.
I thought I had an empty bag of jelly beans in my trash, but I don't. I threw it. I was like, that's my kryptonite. Is I like the gummy sugary substances.
Oh, I love those. Yeah.
Yeah.
But to be honest, like, I mean, I got this from Peru. My brother bring them with me. And let's say, for example, I mean, there's a lot of to decompose when you look into a nutrition label. Like, for example, we talk about fat. Like, you know.
Well, okay. So the discussion about fat, I would say like 10 years ago was kind of the focus.
Oh, yeah. Remember
people talking about trans fats, saturated fats. So the focus was like zero fat this, but then we didn't focus on the sugars. And now it seems like we're focusing more on the sugars, right?
So here's the deal. When they actually have a product and I've realized that saying like, oh, reduced fat or 0% fat, they can look into a sugar. It's probably like way high up, like 18 grams, even to 30 grams I've seen.
What did you say?
Like whenever they have a product and they say like, oh, fat has been reduced or 0% fat, take a look into a sugar. They actually raise the sugar.
They raise the sugar.
Oh yeah. Because like I think a perfect example to actually address this is Coca-Cola, the drink everyone loves, right? It has phosphoric acid, it has a ton of substances. And actually, let me take a look into the nutritional label of the Coke here.
I don't think you want to do it. It's probably like 40. I will say like
no, I just want to take a look into the macros. That's it.
Oh,
nutritional label. Let's see. Okay, so here's something like we actually need to look forward. It says 0 fat, 0 grams of fat, 0 grams of saturated and trans fat, and it has salt on it. And at the same time, it has 39 grams of sugar.
Oh, it's lower than I thought it would be. I think Pepsi has like in the 40s.
Only one can though. And
Yeah.
people can drink 3 of those a day. It's such a big amount of sugar here. But here's the deal, like, you know what's the trick here? They put salt because salt itself makes you thirsty. Same with, and why do they put sugar? To actually make the flavor look actually absolutely amazing. So once you drink one and probably wait like 20 or 25 minutes, you'll be incredibly thirsty and you'll like to go for a second one, maybe a third one or fourth one. And that's actually terrible for you in those terms.
But that's part of the hard thing about changing consumption habits in America is like you're free to choose and eat whatever you want.
And that's something I actually liked. Yeah, because like when I came here to U of I came here weighing 74, 75 kilos. I don't know how many pounds is that, but I end up getting almost 10 kilos after my first year here in the US.
It's a big glass of wine. 4.
You have some there for the rest of the conversation.
Oh yeah. So we finished the bottle. This is Chateau Nico.
Okay.
I don't know. I just buy wine based on the labels. So this one's like a simple looking label. I don't know if one can see it.
Nico.
Yeah. Huh. Anything with the word chateau in it, I'm like, oh yeah, I'm getting that.
That's it. That's a big deal.
So it's probably similar to like how, like I don't drink soda. And I'm thankful. Yeah. Something I really appreciate my mother about is how like nutrition wise, she was always good about it. Like, whereas like at a young age, when I'm in grade school, all my friends are eating Twinkies and chips and soda. She never put that stuff in my lunches, and I hated her for that. But long run, I don't have the taste for it. And like soda, if I drink soda, I feel like physically ill.
Yeah, right. It's like,
but if I drink a glass of wine, I don't. So
there you go. But sometimes it's like, I mean, yeah, I barely drink soda. So it will be weird for me drinking a soda, but whenever I drink one, it will be like probably a zero Coke, which is half as bad as a regular Coke, I guess. But
how many different and there's so many variations of,
yeah, I got no idea why. It's like they have like Coke Zero with 0 calories, Coke Zero of 0 caffeine. What's the big deal here?
So then we're getting into another issue, and that's like
you have so many variants.
The variants, and they're designed to get you to keep consuming it, right? The addiction to it in a way, right?
Yeah. It's because like you have something new to try every day. It's like same with Oreos, right? I mean, for example, in Peru, we only have 2 Oreo flavors, like the really classic one, and we have also the vanilla ones, the yellow ones. Here you have mint Oreo, mocha Oreo, pumpkin Oreo, like probably every single kind of Oreo in the world. I don't know.
That's because this is America, and
exactly.
And we get a variety, and you get to choose whatever you want.
But here comes like my story. Like when I came here on freshman year, I came here with 163 pounds, and I got up to 185 in my first year here, in my first semester. I was eating like a maniac. Like I remember one of those nights I actually chugged a huge bag of M&Ms by myself, like those big ones. I was like, ah.
Yeah. That's called the freshman 15, isn't it?
The freshman 15. I didn't know that was a big thing here. Like,
that's a term.
Yeah,
it happens to everybody, I think.
I learned about it like afterwards, but I didn't know about it.
Yeah. But so what does that have more to do with? Like, just you're on your own, and you just kind of there's no supervision to look over you, so you just do what you kind of want, and then those are the results, right?
Those are the results. But then I actually took conscious about it, and I was like, okay, I've actually hit the rock bottom here. I need to actually, try to lose a little bit of weight to get a little bit more healthier, start doing a little bit more of exercise, and I actually got to reduce like a lot of weight from that.
So then, minus COVID, what would you say as far as public health goes, some of the best things we can be doing to address these issues?
So I know here in Chicago, you guys have a sugar tax, right?
Not anymore. There was
Not
such an
anymore?
uproar about it. Yeah.
Really?
See, this is what we haven't talked about too, is low income communities
Oh
consuming
yeah.
more sugar related products.
Hmm.
And then that
But
gets into like food scarcity and availability of healthy food in areas, food deserts.
mhm,
Have you heard that term before?
never.
Oh, okay. So this is like saying low income areas not having access to grocery stores with healthy food within
I see.
a close range. So
Hmm.
then you're stuck kind of eating foods that are more processed, more perishable or
Of course.
non-perishable, and then the effects of that continue.
But it's like, even though in those stores, I'm pretty sure you can find at least a piece of chicken, right? For to
Mhm.
cook for yourself. And that's something I should notice about here. Like most Americans, like I don't know if they actually can cook by themselves. What do you think about that?
Yeah, that's certainly
Like, and
something. It's also like education, right? And
yeah,
most
exactly.
most of these public health issues that we're talking about are coming from low income areas, most
Hmm.
likely in inner city and then rural America,
Yes.
where the education can be an issue in a way.
No, yeah, I completely
You
get
know what I
it.
mean?
Like, yes, for example, I learned cooking from my mother, and I really appreciate for today, to be honest. I always cook my food down like actually to go out and eat, but I know there are like some people here in the US, like they don't even know how to fry a chicken, for example. And that leads to another topic because they can get a salmonella or other bacteria, and that's a big problem. But as you mentioned, like I feel that maybe government should promote a little bit more of education in these low income level areas about like healthiness in terms of the food you eat.
We were on this trip in 2018, and it was me and a few friends, and we went to Southeast Asia, and we went to Hong Kong and Vietnam and Thailand on this trip, and we were in Phuket, Thailand, on the beach, and we were having, I think, breakfast, and the topic came up. What do you think the most important subjects are to teach children?
Mhm.
And we determined nutrition being one, and we're talking specifically high school, I think.
Mhm.
Nutrition, like overwhelmingly one, and then we kind of debated about history in a way. But nutrition at a very education at an earlier age would
Mhm.
prevent a lot of these things where we have to then put resources towards them later on to address them when we could be using those resources for other things, right?
Yes, exactly. But also, like, what's one of the problems here in America as well? Children who are like between 5, 7, 10 years old, they're getting the diseases that people of 50-year-old are having, like fatty liver disease. Have you heard about that?
Not specifically, but I can
It's
imagine.
basically accumulated fat in your liver, and that's basically terrible for you, to be honest. Like they're like insulin resistant, they're like morbidly obese, and we're talking about people who are like 10 years old only, children. And why is that? It's like mostly because of the huge consumption of candy they have, because of all the sodas they drink. As you mentioned, like they don't have a proper nutrition. So it can lead to future problems like diabetes, even cardiovascular diseases.
Yeah, which comes down to the education on it, right?
Exactly. Everything
And the
like
implementation.
implementation. Like Sometimes I feel like, for example, a sugar tax, it should not be applied, for example, to the lower income areas, to be honest, but they should promote the sugar tax they have from the higher income areas and distribute the tax into the lower income areas, just to have like a bit more of education on on these topics.
Yeah, that was quite a hot issue. Like once it was in effect for maybe like a few months.
Mhm.
There was so much outrage for the sugar tax that
Oh yeah,
it was then repealed.
Ay.
I remember that working in the restaurant when I would charge someone for like a Jack and Coke, right?
Mhm.
Then you have the tax, and then the tax comes up. Something as small as that. Of all the issues, something as simple seeming as that sparks the most outrage. It's interesting.
Yeah, and as we said by the beginning, it will be hard to explain this topic to people without like getting them triggered, right?
Right, because it's not, you don't want to put anyone down. You don't want to offend people in their potential habits that they've been practicing. It's the general question of how do we create and promote a healthier way of living for an individual, and also as a society that's healthier as a society.
And at the same time, it's not to bother the people or to tell them what to do. It's basically because we want to help them to prevent other diseases they might get when they're older.
Yeah, that's such a hard task in America, because everything is rooted in freedom. Don't tell me what to do.
And to be honest, I love it, but it's like there's a point where there's actually like something that needs to be done.
Yeah. So these are public health issues. Some of the issues we addressed them in our last episode, and gene editing.
I think I talked about a little bit about bacteria last time.
I think so. What's on your mind as far as biotechnology?
I haven't read much about biotechnology, to be honest. Like the only thing I see on the news is like COVID, and
yeah,
no much about it. Like they're basically just trying to get the vaccines out to the market and make it more accessible to other people.
So what's then something you're curious about?
In which terms?
Let's say in biology and then in general.
In biology, what I'm curious about, like, well, as you may know, like I like to go like for different biology topics, like COVID, maybe like diseases as well. But something that actually goes through my mind in terms of diseases is like there's a disease called atherosclerosis, which is basically the clot of your arteries, and that comes to cardiovascular diseases. So is there actually like a correlation, an extremely big correlation between the food you eat and the chances of you getting atherosclerosis, being obese or not obese?
So say that again. So you're wondering if there's a big correlation between like this particular thing, which is the clogging of the artery.
Yes.
And obesity?
Basically, yes.
Okay.
Like there's not I've been reading quite a little bit about it like over the last months, and there's not actually a direct relationship between like obesity or maybe the food intake, but it goes mostly down to biology, to something called apolipoproteins, which is a carrier protein. I don't know how else to explain it, but basically they distribute these fat particles all across your body, and they may end up clogging your arteries. So it's like, are these apolipoproteins actually they get like influenced by the food you eat, like by your habits, demographically? I don't know. It will be something interesting to actually take a look at.
Something my mind has been on recently is how I've been talking to some physicists on the podcast.
Okay.
And how like everything in the universe is made up of atoms, and it's how they're assembled that makes things what they are. And so you can take, if you're looking, especially say at what you consume, right? You're putting atoms, small molecules of things into your body and how that can affect your body. It makes even more sense to me how the health of your body is oftentimes a result of what you put into it.
That's
going down not even to like what you're eating, but also the air you're breathing and water you're
oh
drinking.
yeah. Well, luckily we have a lovely topic these days called biochemistry.
Elaborate on that.
So I'm not a biochemist, to be honest, but I know that in terms of nutrition, whatever you want to explain how a food actually decomposes your body, what effects does it actually have in your mitochondria or your cells, they actually go into biochemical reactions, which are like basically molecular reactions inside your body that actually made from stage A to stage B happening.
Okay. So
I don't want to get my hands
too
deep into there because it's like a really complicated career. It's like too how can I say this? Too big.
That's a deep
that's a deep major, yeah.
Yeah. So you're focusing more on like overall big picture statistics,
yeah.
and like
statistics, COVID, diseases. But something that all scientists have that curious about is like, why is this thing going on? Like scientists like are obsessed with knowing the truth about it. It's like an obsession people has, especially when they're studying like these topics.
So you're curious if there's a big correlation between these diseases caused by clogged arteries and obesity.
Obesity depends on the food intake you also have, or it can be like genetical. There's such a lot of values here that can go in, variables. It's a really big picture, that thing. And to be honest, like I tried to actually look, I think I did like a presentation about it for a past class, and they actually said that, for example, this disease was more prevalent between obese people and basically they said obese people and diabetic people. And I actually took a look into the CDC map, and mostly the areas of the south are the big reds for obesity and diabetes. And actually, like, I didn't find more demographical information about it. And I said my conclusion saying, like, if there's atherosclerosis, I'm pretty sure it should be like around this area.
If there's a what?
If there's like atherosclerosis, like the clot of your arteries, it definitely happens like mostly around this area, just because of this, and these variables.
Go more into these variables.
So atherosclerosis, as I mentioned, is happened because of obesity, but at the same time, it has something to do with the apolipoproteins. Like there has not been like much research about it to establish like a direct relationship about it between apolipoproteins and atherosclerosis, but they know something is happening there. It is known something is going on there with the apolipoproteins and the way they distribute the fat across your body that end up being in your arteries.
Do you think we'll get to a point where we can reprogram how our body works? As far as the fat cells or the content you're talking about going to your arteries, is there going to be a way in the future to reprogram it so it doesn't go to those places?
I got no idea. Like, as I always say, like the body is the most mysterious machine in the whole world. Like, we know a bit part about it, but we don't understand it fully. It would be cool, to be honest, like to actually like be like, okay, like I don't like this, we'll just not click a button and we erase it. But I don't know if that will be even possible. Not in the near future.
Yeah, that's like if you can lose weight by eating cake and donuts and
oh, that'll be so good.
Well, how do we not know more about the body? Is it because we're creating so many variables that go into our body more and more?
Exactly.
Or?
Like for the explanation of something, there's always a backward explanation. Like it's like a chain. Like we like to go to the origin of the chain, but it just keeps going on. There's always an explanation for what's going on.
And then it's hard to get results oftentimes because results take just years and time to accumulate.
Exactly. Yep.
Especially if you're looking at something, say like air quality, right?
Oh yeah.
Like in these 20-year span, this is
what we have.
How many people, this is the data of how many people had respiratory issues in this city compared to the next 20 years. And because of these measures, what is the difference? And it's just like living the human story. And there's only so much information and variables available to us. And we're just kind of like guinea pigs in a way.
Exactly. It's like you are always gonna keep adding things to your model. Like nothing is like 100% predictable. I mean, it will be amazing, but it's simply not.
So we talked about CRISPR last episode. What is something that you're excited to know more about in the next few years?
To be honest, I actually want to know if like virus can be treated like CRISPR, for example. Like I know some groups were doing COVID testing with CRISPR, which was actually more efficient and way faster. However, like you need to use like pipettes, and apparently like they don't want people to use pipettes. They don't want to make them use laboratory equipment without the proper use.
What is this pipe what?
Pipettes.
What's that?
Pipettes. So it's basically maybe I'm saying the word wrong, to be honest. It's pipette.
Here, how do you spell it?
PI.
Okay.
Oh wait, let me actually look it up here. It's yeah, so it's PIPETTES. It's basically just to transfer
those,
liquid. Yeah.
Okay, that's what I kind of thought you were. One. Yeah. So there, for those listening and watching, those are those things that go in your nose when they're testing these like swab things.
Exactly. Yep. And like as I said, like there are people who are actually trying to get a way more efficient way of doing COVID testing with CRISPR, but they require the use of laboratory equipment such as pipettes, but they don't want regular people to use them. But like maybe they can use it in an improper way. They can actually hurt themselves. Maybe not. Like no idea.
So you're really curious about the virus, like virus. How do you say that? Virusology.
Virology.
Virology. Yeah. And the ways that we can impact it and address it to make it better in the future, right?
Exactly. Like as soon as the topic is interested, I'm interested.
Is what?
As soon as that topic is like incredibly interested to caught my attention, I'm full time into it.
Yeah. So what can CRISPR do that we can't do now with viruses?
Like to be honest, I'm also curious, like if actually CRISPR is gonna at some point be able to identify the genome of the virus and actually just code it, because as we said in the previous podcast, CRISPR is basically a coloring machine.
That was an incredible episode, by the way. Like that, the possibilities with that are just
they're so big. It's a big panorama here.
It's like you get this virus, and then you're just like, nah, I don't want it.
You don't want it, delete, boom.
Delete. Wow.
That'll be great at some point, but like I don't know how far technology can go. It's just unpredictable.
Yeah.
But me personally, as a biostatistician, like as a future biostatistician, I'm like most interested of how things work and why does this happen. And for this, like you actually need like statistical tools as well. And I'm also like really interested into clinical trials. Like I want to see how something affects a population by itself. I want to see it by myself and analyze it by myself. Like that's my main area of interest.
What do you mean by that? By like seeing it yourself?
Like clinical trials, as a biostatistician
Oh,
in
clinical
trial.
trials.
Yes,
Okay.
I will basically get all the data caught by the scientist, and I will analyze it, and I will draw my own conclusions from there, or like the obvious conclusions. And that's what I'm mostly excited about, because like I can see by firsthand how does something work.
Yeah.
When it comes, for example, the COVID vaccine.
Mm-hmm. What vaccine did you get?
Moderna.
Yeah, when I tell people I got Moderna, people are like, "Oh, Moderna." Is
We're
that like the
Gucci
name brand?
vaccine here.
What's that?
We're the Gucci vaccine here.
Yeah. That's like the luxury brand of
Yeah, I don't know what's
vaccines.
going on with the vaccines, but like I know that Moderna actually gives you like an extra layer of protection compared to Pfizer. Like it gives you like
Okay.
a little bit extra.
Yeah, that's interesting. That was always interesting when that
Yeah,
comes
like I
up.
haven't get my booster yet, to be honest. Like I'm not like the kind of person who like to get a booster like every 3 months or every time a
Yeah.
new variant emerges. So I'm waiting till Pfizer releases the Omicron vaccine. I'll get that one as soon as it gets out.
Okay, so you got the full Moderna one.
I got 2 doses of Moderna, but I don't have a booster.
Okay, I'm in the same situation, same exact.
Plus, I got COVID last year, so far I don't need it. Like technically, I should need it because it's been more than 3 months, but still, I'm waiting for Omicron, because like if another variant comes out, what, like they're gonna recommend the 4th, 5th, 6th booster shots? Like,
Yeah,
there's no point.
interesting. Well, this has been a fabulous conversation. Thanks for coming on and discussing some of these issues with us.
No, of course, I love it.
Yeah, and I'm excited for you to move to Chicago. That'll be a lot of fun.
Well, next episode should be like in a nice Chicago area, like in a coffee center or something.
Oh yeah,
Definitely.
I'm down for that for sure.
There we go.
Yeah, where can people follow you and learn more information about what you're doing?
Like I just got a Twitter account. I can send it to you if you want to, and my Instagram as usual. I usually don't post much on Twitter, but I'm trying to.
Yeah, I think we're all in that position. I'm trying to do a little bit more. I know I should, but
it's like, I don't know. Sometimes I get nervous about posting on Twitter because like I know how toxic can it be.
Yeah, man, that's Twitter is I don't use Twitter much at all. And
I use it like mostly to watch the news, but in terms of me like commenting about it, it's like maybe yes, maybe no. It's like I have that comment in my mind, that thing I want to put down, but then I'm like, I don't know if I should put it or not.
You don't know until you test it.
Exactly. Yeah, but I don't want to cause a huge deal here, or like I don't want to, go into the toxic area.
Yeah, I find Twitter to be, just from what I see, I don't post a lot, but Twitter is, you can see the value in it.
You can see the value of Twitter. Yep.
But it's also like too, at what cost? And that's something I think about. But I do find I think more analytical or more like technical minded people are on Twitter, or like people who are more like word based rather than visual based.
Yeah,
I think are more on Twitter, whereas like I'm more on Instagram. I like the visual communication. Yeah, Twitter, man. Twitter. Well, on that note, thanks again for coming on. This has been great. I love this episode 187. We talk in depth more about CRISPR and the implications of it and what it means for the future of humanity. Thanks again. Always great.
No, yeah, thank you so much for inviting me. I really liked it.